Hi everybody, this is Beth Innis. I am coming to you live from my house in Belmont, Massachusetts, and I wanted to give you a little bit of a chat about the benefits of having alternative and conventional medicine for your pet. So the reason I'm talking about this is because it's a question that I get often, and I'm excited to talk about it because I love both medicines, both conventional medicine and alternative medicine. So first, I'll start with kind of how I got into acupuncture and alternative medicine, and conventional medicine for that matter too. So I am one of those kids who decided that she was going to be a vet when she was in the 4th grade. I read a bunch of James Herriot books, which if you haven't read them before, they are lovely. James Herriot is a veterinarian who is or was focused and living in England, and describes his mixed animal practice, so large animal and small animal, in kind of the mid 20th century, and is just lovely, and the stories are lovely, and everything was very motivational for me, and I'm not the only one who went into veterinary medicine as a result of James Herriot. So I grew up, I never thought about any other career other than being a veterinarian. I believe there was 1 year maybe where I thought about being an obstetrician, but then went back to veterinary medicine. And so I just, since I knew what I wanted to do early, I went to a joint program between University of Massachusetts Amherst and Tufts University School of Veterinary Medicine. So I knew that I wanted to go to Tufts, so I started at UMass, and kind of the programs joined together so that I could do that all at once. While I was at Tufts, we had to do a certain number of elective rotations where we got to choose what kind of medicine we wanted to do, what kind of vet to follow or shadow. And because it was convenient and the hours matched, I chose to follow a local and very progressive and innovative veterinarian in our area who did a lot of acupuncture. And that became an inspiration. And the reason I was very intrigued by the alternative medicine bend was actually not the medicine at first, but it was more the people and the pets that were attracted to that type of medicine. So I noticed that a lot of the clients were incredibly loving. They were very affectionate with their animals. They were patient people. They were open-minded people. Now it is still noteworthy to be an alternative medicine veterinarian, but at the time, which was probably 20 years ago, was even more noteworthy. So to seek someone out for care for your animal in that way was really awesome and really, really different. I also noticed that the animals lived longer and they had these awesome lives, and I just wanted to be part of that relationship. So I spent more time with him throughout my time at Tufts, and whenever I could, I would be in that part of the field. When I graduated, I went straight into practice, so I didn't do an internship because it was time for me to do that in my relationship and my in my life. And so my first job was actually emergency medicine and general practice, and I did that for a year knowing that I wanted to go into alternative medicine, and then I kept following that path, and I got trained in acupuncture, and then I did more and more acupuncture and kind of focused more towards general practice and acupuncture versus general practice and emergency, though I did a little bit of all of those things. And then once I got into acupuncture, I became interested in Chinese herbal medicine and rehab or physical therapy for animals. Because I was seeing a lot of older patients, that led to hospice training and grief counseling. I later became certified in chiropractic medicine. I took courses in food therapy and Tui Na, a kind of Chinese massage that goes with acupuncture. And now I'm starting my training in Western herbal medicine as well. So I wanted to talk about this because I love both parts of medicine. And to me, you cannot have, once you have access to both, I should say, you cannot choose one over the other in terms of certain things. They both bring wonderful things to the table. So for instance, I still love my conventional medicine for a lot of reasons. One of which is diagnostics. So how do we know if there's kidney disease unless we do some blood work and we check some urine? How do we know there's a parasite unless there is a poop sample? How do we know why that older cat is feeling so crummy until we take their blood pressure and realize that it's through the roof? How do we know that there's arthritis or a broken bone for sure unless we take an x-ray? Also, ultrasound, MRI, CT, all of it. It is all so important, and all of us alternative medicine practitioners use it all. And we have different kinds of blood works that we use, and those are awesome, and different kinds of imaging that we use, and those are awesome too. But using those to focus in, get a better picture of what is going on in that body is really, really essential to what I do and what most of us do. There's also treatments that are essential to medicine that we don't want to live without either. So things like oxygen when you need it is incredibly helpful. Antibiotics when you need it, antivirals, antifungals, a whole slew of pain medicines that can be used in combination with our alternative medicine that I feel like I wouldn't want to give up at all. Also, a hot topic is vaccination. So there are some things that I still want to vaccinate for when I need to, and there's some things that I want to stay away from or do titers, which I'll touch on in a little bit. But those things are still really crucial to world health as we see it, especially right now. So there are some favorite parts to both where I think they intersect and overlap and make things so great. So one area is nutrition. So nutrition is just a perfect blend of why we need both medicines, if you ask me. So whenever in either side of the field, whether you're conventional or you're alternative, as veterinarians, I am pretty sure we could all agree that there is no one right medicine nutritionally, no one food that is appropriate for every single pet. You could have so many different things that can go into it, whether it's palatability, how good it tastes, whether it is digestibility, if it is an animal that is has a pancreas problem, they're not going to be able to eat the same thing as someone who has a skin problem. We want to overlap those things. So that I feel like we can decide on. There's no one right way to feed a pet. For me, homemade food is the best because you can make it exactly the way you want it. That is going to work for some people. It's not going to work for other people. It's going to work for some animals and not for others. But if we use as an example, let us say that we have an animal that we want to make a homemade diet for. We're going to use both conventional medicine and alternative medicine, at least at Sleepy Dog, to formulate a diet. So we're going to use conventional medicine to do things like figure out what the energy requirement is for that animal. How active are they? What is their weight? What do they need in terms of nutritional balance? All those things we lean heavily on conventional medicine for. When it comes to alternative medicine, we get to choose different ingredients based on their energetic properties, and that's really exciting. And we can use that not just in homemade food, but all over the map. So there are certain foods that are more cooling. There's certain food that might be helpful for someone with like a hot, itchy skin problem. There are certain foods that are more warming that might be really helpful for an older cat with a kidney problem. So we can use those things to tailor the food to like a more specific degree. Also, a beautiful way that alternative medicine and conventional medicine overlap, and it is being shown now, is that things that taste a certain way, like with a certain taste, like a sweet taste, have similar biochemical properties. And so we can see that these age-old traditions of feeding ginger to reduce inflammation or to harmonize and make things easier to digest has properties that we can apply in our conventional medical system that kind of all adds up and makes sense in our current world. I hope that makes sense. So vaccines. So a lot of people come to alternative medicine expecting to not vaccinate at all, and sometimes that's true. If we have a patient who is older, has an autoimmune disease, has some kind of cancer, I'm going to try to reduce the number of vaccines or eliminate the vaccines that animal is going to have to withstand. From my perspective, I don't want to ask them to have to mount a response in their immune system when their immune system is already taxed. That's the way I think of it. However, we don't have a lot of rabies because there are rabies vaccines that are given. There are some things that need to be given, in my opinion. We don't want to have a resurgence of canine distemper, which is an awful, awful disease. So we want to make sure that puppies get vaccinated. Once they are vaccinated, we can work with things like vaccine titers. So vaccine titers are measuring the level of exposure and protection in the blood by looking at antibody levels to see, is my 1-year-old dog who was vaccinated with their puppy series now most likely immune or can mount an appropriate immune response to distemper. If so, we can hold off on that vaccine. We'll check it again later, maybe in 3 or so years, depending on the animal. So this is a really nice thing to be able to measure and to do. We at Sleepy Dog, we follow the guidelines of a company called Hemopet and a veterinarian, Dr. Jean Dodds, and that's how I kind of figure out how I like to do my vaccinations. She also, and Hemopet can also run rabies titers. The thing about the rabies titers is that is something that is a little bit harder to be universal because we haven't decided as a community, as a veterinary community, and as a public health community, what are the levels that are acceptable. And so that sometimes if an animal is traveling can be harder to just do a titer and be done. It does cost more money than vaccination, so sometimes that's possible for people and sometimes it's not. And it depends on where the animal, who takes care of the animal if you're away, what level of risk the animal has for certain exposures, things like that. So each animal is always going to be an individual, and vaccination is not separate from that, in my opinion. So speaking of vaccination and kind of preventative medicine, another thing that we are often asked about at Sleepy Dog is heartworm prevention and flea and tick prevention. So the area of the country that you are in definitely informs how you address these things. If you are in the southern United States, heartworm is a huge concern, and it is going to be just taken a whole lot more seriously and in a detailed way. We also take it very seriously here in the Northeast. I'm in the Boston area. However, it is not the season is not quite as long. But the other thing we have to keep in mind is we often adopt a lot of our puppies, and a lot of our adoptions come from the South. So we're all dealing with it in that way. Most veterinarians are very worried about heartworm infection because treating heartworm is really, really tough. So in this way, we're always going to weigh those options. If your dog has heartworm disease and they have to get these really serious injections to treat that, and they have to be confined for like a 6-week period of time, you're going to think about it a little bit differently. However, if you have a pet that has a serious reaction to the heartworm prevention, we're going to have to find some middle ground. So there's many different ways that we can address this. Lyme disease is a huge concern in our area, and so flea and tick prevention is always a big concern. It is a hard question because the flea and tick prevention medicines are some pretty serious things that have to be tolerated by the body. Some of them can be removed once they're put on if there's a reaction. Some of them cannot be. There are many different natural remedies and natural applications. However, depending on the dog's level of risk, they may or may not be effective. So again, it depends on the animal, but knowing where you are in the country makes a big difference, and knowing the level of risk. A city dog is going to have a much different concern about Lyme disease if they don't leave the city limits, but a dog who is up in Maine or on the Cape, or on the islands for us, is going to have much more risk, and we may weigh that risk in terms of the benefits. So it just is individual, but I am not ever going to say like we don't need our conventional medicines for these things, because there's no substitute in my eyes in many cases. Of course, there's also fleas. Fleas are so rough once you have them in your house, and when you watch your animals who have them, and they can be really, really miserable. So that's another thing that, for me, the conventional medicines are usually the most effective for. Again, depends on your level of risk. So, like nutrition, another area that is dear to my heart that is a perfect blend of conventional and alternative medicine is pain management. And I think that the blend of these two medicines really shines in this area. In conventional medicine in the past, I would say decade or so, the thought has been multimodal pain management. So meaning that using as many different options to help combat or prevent pain, and hoping to reduce side effects of any of those things by using many different ones. So we can use alternative medicine such as acupuncture, chiropractic medicine, massage, cold laser therapy. We can use rehabilitation therapy, different exercise management, and different enrichment to help with pain. We can use herbals, homeopathics, nutraceuticals. We can also use nonsteroidal anti-inflammatories and opiates and all the other classes of pain medicines that can come in handy. A lot of my patients are on both, and we can certainly reduce the number of side effects and the number of medicines and doses that they're on by using alternative medicine. And there are some patients that I would never want just to have alternative medicine or just to have conventional medicine. So the blend is so great. I think another thing that is really nice about alternative medicine being part of the picture is we tend to see our patients on a regular basis, and so we can see little changes creep up a little bit faster than if they were going longer between treatments. In the same kind of way, and certainly attached to the pain management, is hospice and end-of-life care. I feel like the thing that is true for both medicines, alternative and conventional, is that communication is like the overarching theme of this kind of care. So everybody has to be in a state of kind of on the same page and looking at the same things, and willing to share and willing to give feedback on either end. Pain management is a huge part of hospice and end-of-life care. Behavioral and emotional management, whether the animal has anxiety due to where they're at in their process, whether the animal has some signs of senility or kind of doggy dementia. These things are incredibly important to talk about and to manage with both conventional medicine, medicines and treatments, and also alternative medicine. Nutritional management also super key here. If you have a weakened body and a weakened state, you need nothing more than the right kind of food that you're able to digest. The other thing that is important with both medicines is client support. The people in the situation need to be supported and need to feel that what they're saying is being heard, and that their questions are being answered as much as they can be. And also the other way around, that the veterinary support team is being heard and able to ask the questions to get the information that they need to provide best for the pet. Same thing with quality of life discussions. So important, conventional medicine and alternative medicine. The communication is really key, and using all parts of our toolkit. So whether it's herbal medicine, whether it's a glandular support, whether it's making a certain kind of nutritional blend that can be the most nourishing and the most digestible for that patient. My voice is getting hoarse because I'm talking so much. So I thought I'm going to give you 3 examples of types of types of situations that I feel like are great examples of how conventional and alternative medicine can be used together for the optimal health of the animal. So let's give the example of osteoarthritis. So let us say that a dog was born with hip dysplasia, so the ball and the socket don't fit super well. They're more hanging out like this, and the dog develops arthritis. So there's a lot of bony remodeling and inflammation in a hip joint. So the first thing that we need to do is figure out where their discomfort is coming from. So we would maybe do something like use our thermography if you're at Sleepy Dog, which is using heat to detect where the areas of inflammation are. That might lead us to take some x-rays. X-rays would give us a sense of which of the body parts are affected, how much change is in the joint, and giving us more information that way. The other thing we would want to use conventional medicine for is probably doing some lab work to establish what the organ function of the animal is like in terms of what they're going to be able to tolerate medicine-wise, supplement-wise, all that stuff, and also making sure there's nothing else going on that we need to manage at the same time. So let's say this is a golden retriever with hip arthritis. So we might want to start some acupuncture. We might want to start some chiropractic, maybe do a little cold laser therapy. We might at some point do some aquapuncture, which is when you take a needle and like a hypodermic needle and inject a little solution of something into an acupuncture point. That causes some pressure in the area and has a more long-standing effect on the acupuncture point. So it works like acupuncture, but is a little quicker, and you can also inject some things that might be helpful in the long run. We might add in some massage therapy. We might add in some electroacupuncture. We might do some Reiki therapy, acupressure, just depending. We might add in some physical rehabilitation, some different therapeutic exercise, some mental enrichment in order to keep an animal that maybe has a little bit less mobility now, but still has a lot of zest for life, kind of engaged and tired when they should be tired. We might add in some things like glucosamine and chondroitin, some fish oils. We might need to do things like some anti-inflammatories, some gabapentin, amantadine, tramadol, things like that are in the more conventional realm. We might use something like an Assisi loop, where we can reduce some of the inflammation that is being generated from the arthritic joint and do that in a non-pharmaceutical, non-herbal kind of way, which is with just a physical treatment. There's also things like platelet-rich plasma and stem cell therapy, which is something that we do at Sleepy Dog, and in fact we're blending that too because we're using platelet-rich plasma into acupuncture points at the moment to use a little bit less sedation and anesthesia and a little bit more oomph by being in acupuncture points, but not having going into the joint itself. And then there's assistive devices that kind of span both conventional and alternative medicine, things like harnesses and wheelchairs that might be helpful for those animals in terms of their mobility. So as you can see, a lot from both sides can make that animal's life super awesome. So another example would be, let's say, a cat with kidney disease. So we may have an inkling that the cat has kidney disease, but we might not know to what extent or exactly where it comes from or how things are going for that cat. So first we would want to do some blood work and some urine tests to make sure we know what's going on with that. We're also going to probably want to measure blood pressure because the kidneys are intricately related to the blood pressure system, and so if the kidneys are feeling a little defunct, then the blood pressure is going to be affected. So we may do some tests in that realm. It's also pretty common for us to want to do an abdominal ultrasound to make sure that there's nothing else going on in the kidneys, or that we can see any aging effects on the kidneys, and what kind of kidney disease they might be suffering from. Also taking a look at the bladder and the other organs. We might start with some acupuncture, also some aquapuncture. We might use some herbals and some homeopathics to keep those kidneys functioning. We're going to use nutrition where we can. Alternative medicine and conventional medicine are a little bit at odds at the beginning of kidney disease. Alternative medicine does not want to restrict protein. Conventional medicine does, but when we get to the mid to the late stages, we're in agreement that we want to restrict some of the protein and some of the phosphorus and make the animal feel better in that way. So it's just a matter of timing and the differences. We may want to give that animal subcutaneous fluids if they have blood pressure problems. We may use acupuncture for that, or a blend of acupuncture and herbal medicine, or a blend of acupuncture, herbal medicine, and conventional medicine, blood pressure medicines. We might use things like antacids. We might use things like phosphate binders, all things to make that animal feel better. We also use a bunch of moxa at Sleepy Dog, which you may have seen our videos documenting. That's a really smoky herb that can be really helpful to generate some warmth in the kidneys and get them functioning a little bit better, and it feels really good in the right situation. And my last example, as I wrap up, is cancer. So cancer is another tough place that I'm thankful for both conventional and alternative medicine, because they can work together to help us improve that pet's quality of life and often their outcomes. So depending on the type of cancer, we discover it based on many different ways. It might be through lab work, it might be through imaging of some kind, whether it's radiographs or ultrasound, CT or MRI. However, we find that we end up doing a fine needle aspirate or a biopsy, which is going to lead us into what kind of cancer and how to best treat it. That may lead to surgery, to chemotherapy, to radiation. Those are all conventional things, but they can be greatly helped and supported by using acupuncture and herbal medicine. So some of the most interesting and well-documented studies in alternative medicine have to do with side effects of chemotherapy being treated with things like acupuncture. So nausea is one thing. Acupuncture and herbal medicine can be really helpful with helping to modulate the immune system when it's getting confused about what it's supposed to be doing in the situation of cancer. Am I supposed to be ramping it up or dampening it down? Acupuncture and herbal medicine are really helpful with that. They can also help with pain that's associated with the cancer or the side effects, and all sorts of other things that we probably don't even know yet. Again, another example of where communication is so important when it comes to care for patients, whatever kind of patients they are, in my case, cats and dogs, because in order to make sure that all of the conventional medicine is working with the alternative medicine and the quality of life and the general lifestyle of the pet is being managed in a way that feels good for the pet and the person, their pet parent, we all need to be in good communication. So those are my examples that I brought for you today. I hope that's helpful, and I hope it helps explain a little bit why we should use all we have in order to help our pets and bring them the best lives that they can have. If you have any questions, feel free to email us or give us a call. You can also make a note at the bottom of this video, and if there are any topics that people would like to hear in the future, please let me know and I will bring them to you. Okay, thanks. Have a good day. Enjoy the beautiful weather.